House Leader of the Third Party.
Yeah, thank you, Mr. Speaker. Under this Minister of Health, spending has increased from $18 billion when he took the office to $36 billion now. A year ago, the minister agreed to adopt minimum nurse-patient ratios. The minister told nurses that help was on the way. However, the experience of British Columbians trying to access health care and Stats Canada paint a different picture, Mr. Speaker, than the version of exceptionalism that we hear day in and day out. According to Stats Canada, there are nearly 5,500 vacant job postings for nurses across the province. BC nurses are here today. They want less announcements from the minister and more supports. More supports to retain nurses, including a provincially coordinated plan to address the systemic workplace health and safety concerns that have been raised over and over and over again. The minister's $36 billion health care system is in crisis, Mr. Speaker. What is his plan to retain nurses, and will he deliver a provincial plan to address the health and safety concerns he's known about and failed to solve?
Minister of Health.
Well, thank you very much, Honourable Speaker, and we're doing just that. We're working specifically with nurses in British Columbia on the issue of nurse ratios, a historic commitment that we're putting into place, Honourable Speaker. In the last number of years, we've led Canada in new registered nurses, including last year, Honourable Speaker. The increase, Honourable Speaker, in the 12 months of 2023 was more than 6,000, Honourable Speaker. That has involved the increases we've made in nursing spaces, the improved pathways to internationally educated nurses, and the dramatic increase in number of spaces for nurse practitioner, more than double they were when I became Minister of Health. Honourable Speaker, finally, I would say with respect to the issue of health and safety, one of the key proposals by the BC Nurses Union, by the Hospital Employees Union, by the Health Sciences Association, by the doctors of BC, was to change the system of security in acute care. We said we'd do that. We said we'd hire 320 people in a year. We put in place a new relational security model, and we have delivered on behalf of nurses and others in BC.
House Leader, Third Party, supplemental.
What's doubled is this healthcare minister's budget, and yet our healthcare system is still in deep, deep crisis. You know who is doing well under this minister, and that's private healthcare corporations. They're doing really well under this minister. One of the ways he's tried to address the shortage of nurses is through the expansion of agency nurses. The Premier wondered out loud recently, quote, how adding profit margin to the limited number of healthcare workers, how we have somehow improves services for people. It's a question that the Premier asked, and it's a good question from the Premier, and I'm wondering if he asked the Minister of Health right before jacking up his budget again this year. This Minister of Health is relying on agency nurses, adding cost to the system, and profit, Mr. Speaker, for corporations. Dispirited nurses, exhausted by the lack of support by this $36 billion minister, leave the public service to join the for-profit healthcare system. The result is a 400% increase in spending for agency nurses over the past 4 years to the $36 billion minister. We're seeing creeping privatization of healthcare under his watch. It appears to be his strategy. He's doing it with public money. When is he going to come clean and just admit that's what he's doing?
Minister of Health.
Honourable Speaker, the facts are the opposite, Honourable Speaker. The facts are the opposite. We have the largest capital building program in the history of the BC healthcare system. Every one of those projects, Health Authority owned and operated, Honourable Speaker. With respect to nursing, Honourable Speaker, we've increased 602 nursing spaces in British Columbia's colleges and universities. We've improved pathways to internationally educated nurses. We're leading Canada in new nurses, while other jurisdictions such as Alberta have lost nurses in the same period, Honourable Speaker. The fact of the matter is we are working with nurses as we worked with doctors, Honourable Speaker, to ensure that working conditions for nurses improve, that nurse ratios are put in place in British Columbia, and that we're adding nurses to our system. The facts say that, Honourable Speaker. The member can be opposed. The member is suggesting he's opposed to more money to pay for health care when we have 650,000 people across British Columbia.
Members.
If that's what he's saying, I disagree with him, Honourable Speaker.
Members.
I disagree with him, Honourable Speaker. Honourable Speaker.
Members.
Talk about results. Leading Canada in new nurses. Putting in place, well, Honourable Speaker, We had around 300 nurse practitioners in BC when I became Minister of Health. We now have more than 1,000. That's important. That's a change. That's an increase. We led Canada in new registered nurses. Hasn't always been the case. There's one health minister who lost registered nurses in the history of BC healthcare. That was the leader of the opposition. But we are leading Canada in new registered nurses, and we're going to continue to recruit, retain, and make life better for nurses in British Columbia.